Welcome to the Parent Orientation to Early Access, Birth to 3 Services. This video was developed in response to a need identified by Heartland's Parent Advisory Committee, which is composed of parents of students who are currently receiving early access and special education services. This committee felt that parents and families of children who have been newly identified as being eligible for early access services would benefit from having access to some foundational information about early access services that their child may be receiving. The intent of this video is to not only help parents understand the purpose of early access, but also help parents understand how they can advocate for the needs of their child and the process for developing and implementing their child's IFSP, or Individual Family Service Plan. Early access is a federal program that is available in all 50 states and the territories. Each state, however, may choose a unique name for their Part C program. In Iowa, the name of the program is Early Access. The purpose of early access is legislated. An important aspect to emphasize in the Iowa administrative rules is the notion of enhancing the capacity of families to meet their child's needs. Our goal is to simply enhance an already natural role, that of being a parent, by listening to the family's concerns and prioritizing and planning interventions that can occur naturally within the context of the child and family's everyday routines. Office of Special Education Programs, or OSEP, reinforces this notion in the definition of early intervention to support and promote parents' competence and confidence in providing their children's development, enhancing learning opportunities. The law also emphasizes that the early access system must be community-based, flexible, coordinated, interagency, and family-centered. There are 4 signatory agencies that make up the early access system in Iowa. They are the Department of Education, the Iowa Department of Public Health, the Iowa Department of Human Services, and Child Health Specialty Clinics. Having expertise from these agencies and all of their community partners create a comprehensive constellation of services and supports for infants and toddlers and their families. The purpose of early access is for families and staff to work together in identifying, coordinating, and providing needed services and resources that will help the family assist their infant or toddler grow and develop. There are a number of fundamental concepts that underpin early access. The first, child find, is simply reassuring that children who are potentially eligible for early access are identified and provided the opportunity to be evaluated for eligibility. We endeavor to reach out to primary referral services such as hospitals and pediatric clinics, including employing a liaison to the NICU at Blank and Mercy in Des Moines. We participate in various health fairs and toddler festivals. We ensure membership on various early childhood coalitions and our advisory boards in an effort to work with our partners in finding children who may benefit from early access. Iowa's definition of eligibility includes known condition or 25% or more delayed. There are some circumstances which make children automatically eligible. These children are born prematurely, have been or are in foster care, or have been drug affected. Known conditions include conditions such as syndromes, spina bifida, Fragile X, central nervous system disorders, etc. To be determined eligible, you must have a child age birth to 3, a child either with a known condition or a disability that may cause later delays in development, or may already be showing delays in his or her ability to play, think, talk, and move. Eligibility is determined by using a diagnostic instrument. The evaluation looks at 5 developmental domains: cognitive, physical, which includes health, hearing, vision, and nutrition; communication; social, emotional, and adaptive. The eligibility evaluation is required to be multidisciplinary. that is, conducted by 2 or more professionals from different backgrounds. Because these decisions are so important, we never want to rely on only one person making the decision. We also don't want to rely on only one person as a source of information when making decisions for the individual family service plan. Team members, which include the family, use a process we refer to as RIOT, which is review, interview, observe, and test. Listed here are the mandated early intervention services defined in the Iowa Administrative Rules. Early intervention services are at no cost to families. The evaluation and assessments that are conducted help to inform what services are needed, and based on the family's priorities and concern, what services will be included in the IFSP. Iowa embraces using family-centered principles. These principles include family empowerment, mutual respect, active participants, identifying family priorities, informal supports, collaboration, and flexible and responsive supports. For more details about these specific principles, you can find on the Department of Ed website under Iowa Script. Service coordination is considered a cornerstone of early access. Each family is provided with a service coordinator, a person who is a central point of contact for the family. The service coordinator ensures the following things. He or she coordinates evaluations and assessments, facilitates and participates in the development of the individual family service plan, assists family in identifying service providers, coordinates and monitors the delivery of available services, and helps facilitate the transition plan upon a child's 3rd birthday. Individual Family Service Plans. The plan, which is referred to as the IFSP, actively engages families in planning and decision-making. The IFSP document reflects the family's wishes, hopes, and dreams. It reflects any changes as the family needs changes. And the IFSP is reviewed periodically and annually. Please take a minute to read the following slide. The family's priorities and concerns drive the IFSP. It is important to note that unlike an individual education program, the IFSP also addresses family outcomes. Outcome is a word used in early access that means results. We know that caregivers and parents are not going to be able to focus on their child's development if they are not getting their basic needs met, such as housing, transportation, or entitlements. For example, if there are other issues in the family, such as stress, substance abuse, or mental health, it is important to remember the meaning behind the acronym IFSP, Individual Family Service Plan. Each plan is individualized. The plan is developed specifically for the unique child and family. The child and family's strengths, needs, concern, priorities, and resources are unlike any other families, so their plan will also need to be unique and unlike to any other. The IFSP also addresses the changing circumstances and development of the whole family. We know from research that families are more resilient when they have informal supports. We also know that children are more likely to achieve their outcomes if their parents and caregivers are responsive and engaged. In fact, this is a very powerful determinant in a child's growth and development. Towards the end, practitioners may take a more side-by-side approach to providing interventions. It is clear that children and parents have tens of thousands more learning opportunities throughout the course of every day in everyday routines than even the most intense interventions by practitioners. The plan is dynamic and ever-changing. It is created by families and providers to guide them towards family goals that will support the development of their child. In other words, the IFSP is a living document. The plan is revised every 6 months, referred to as periodic, or annually. However, it is important to know that the plan can change any time given with the ever rapidly changing needs of infants and toddlers. The next few slides will address transition to Part B or IEP services upon your child approaching their 3rd birthday. You can either continue listening to learn more about transition services or access this section at a later time. Transition services prior to a child's 3rd birthday. Service coordinators must initiate a transition meeting at least 90 days and up to 9 months prior to a child's 3rd birthday. If the child is eligible for Part B services, an IEP must be developed and implemented by the child's 3rd birthday. Transition planning meetings provide opportunities to consider Part B special education services, discussions with families about future placement and services, discussion of appropriate services including services after the child turns 3, and discussions regarding transfer of records. The plan must include ensure a smooth transition to Part B, other appropriate services, and exiting the program. Also must describe how families will be included, steps for the child and steps for the family, and also notify the local education agency or school district the child may potentially be eligible for Part B. For more information about Part B services, see the next video, which would be called Parent Orientation to Special Education Services in Early Childhood. A transition toolbox developed by the PEC, Parent Ed Connection, is a useful tool designed with 6 steps that can be used throughout the transition process. The toolbox can be found at www.aea267.k12.ia.us. From the home page, you can click under Quick Links under Special Ed, then click Family Education Connection, and then finally click Early Access Transition Toolbox. The intent of this video was to help you understand the purpose of early access and how you can advocate for the needs of your child and the process for developing and implementing your child's individual family service plan. You may contact your child service coordinator or other AEA team members with any questions or concerns. You are the most important team member in planning for your child's education. Thank you.